Hi, in this video we'd like to do a brief explanation and overview for PCOS. Now we've repeatedly talked about PCOS as it is one of the most, if not the single most common gynecological disease that most women are facing nowadays. It is incredibly common. However, women are not seeing effective treatment, and here at the hospital we do offer a specific surgical management that is effective up to 95% success rate. So PCOS is a lifelong disease if you are not receiving the proper treatment and assistance and support that you need to lead a high quality life, a normal life. PCOS is quite severe because it can affect your many aspects of life and cause certain symptoms that may affect your physical appearance. PCOS, in its root cause, is caused by a certain presence of these testicular tissues that have not reverted or completely eliminated in your process of embryogenesis. So during embryogenesis, in the pregnancy stage, when we are still an embryo, a fetus, there is a process known as gonad differentiation. So this is where the XY chromosomes takes place so that we form our separate sex organs. If you are a male, then you will form testes. If you are a woman, then you will form ovaries. This is the natural process. However, for women, during this differentiation process, there is a possibility for some remaining testicular tissues that have not completely eliminated during this process. So it's actually a combination of both ovarian tissue and a little bit of testicular tissue. It's a combination tissue. For women who don't have PCOS, they see in only one form of tissue, which is ovarian tissue. But for women who have PCOS, it is already determined that these ovaries carry a slight amount of testicular tissues, so which explains that PCOS is also a congenital condition. So most women are born with this. It's unlikely that you will develop this over time after you are born. Most women are actually born with this condition. So despite the low levels of these testicular tissues, we call them Leydig cells within the ovaries, it is already enough to cause a significant difference in their development and also some symptoms and also how it can affect their fertility. So women who have PCOS, because of these testicular tissues, they have high levels of testosterone chronically. So over long term, being under this high level of testosterone, women will develop very masculine features, very masculine secondary features. For example, they will have high body hair, excessive acne over the face, the neck, the body. This is also very common that we see. They will also have features such as having a slightly rougher, darker skin, a rougher voice, very masculine overall. This is actually due to the PCOS. The symptoms can vary according to severity. Chronic disruption of the hormonal balance because of the higher levels of testosterone can also affect the metabolism of glucose and fat, causing something known as insulin resistance. So these women also have another distinct symptom, which is having a high level of body fat. Usually these women are either fat or obese, and it is actually caused by the root cause of this PCOS, the presence of these Leydig cells. Another common sign of a PCOS is that these women will actually frequently miss their periods. So there's either disrupted ovulation, maybe it's coming every 30 to 40 days, their cycle, instead of 28 days. Some are even longer, it takes even months, and some only experience ovulation once or twice a year. This is actually because these ovaries, despite the egg cells maturing within the ovaries, it is unable to penetrate outside into the fallopian tube because the ovaries is hardened now. Because of the presence of these Leydig cells, the high levels of testosterone, it is making it very difficult for mature egg cells that want to be released but is unable to penetrate through the walls of the ovaries. This is why we women experience anovulation, missed periods, which inevitably leads to being very difficult for you to get pregnant, a form of infertility. And even if you do get pregnant, because of the maturing of these egg cells are of lower quality, it is associated with higher risks of recurrent miscarriage. So here at Anta Hospital, we understand that PCOS is one of the prominent causes for infertility and recurrent miscarriage. That is why we offer you an effective treatment to overcome not only all these symptoms that we listed, it can also help you lose the weight incredibly fast and also allow you to achieve healthy full-term pregnancies with no infertility and no miscarriage. Now, this technique that we use is simply using 3D laparoscopic surgery, and we've been doing this for over 25 years with high success rates, and all we need to do is our surgeon will expertly identify these Leydig cells within the ovaries. That is the root cause of PCOS. So for both ovaries, once we identify these Leydig cells, these testicular tissues that were abnormally present, we need to remove all of these. And upon recovery, a patient will see very quickly that symptoms start to go away. They begin to ovulate every 28 days now because the Leydig cells are removed, and they are allowed to go for full-term healthy pregnancies. They don't need to go depend on PCOS medication, which is just a form of oral contraceptives, combination of estrogen and progesterone. These do nothing to suppress PCOS. It only deals with the symptoms and is still unable to treat the underlying fertility and recurrent miscarriage, which is why surgical management is the best approach. This treatment is offered by Anta Hospital with a full refund guarantee and a success rate of up to 95%. The sooner you get this treatment, the sooner you will see higher quality of life and also the ability to get pregnant, not only successfully but naturally as well. So get in touch with us via the website and also leave me a comment down below as feedback.